Hello friends, I am Dr Priyankur Roy, consultant in Reproductive Medicine, Genome the Fertility Centre, Siliguri. Today we are here to discuss about Donor Oocyte Programme. Now, Donor Oocyte Programme is a term which is a newly coined term and which is only possible in artificial reproductive technique, that is ART. So first, a little bit about the physiology. Sperms are always produced lifelong in a male partner, but in a female partner, eggs or ovum that is given in the ovaries are given at birth and slowly gets exhausted as the age progresses. So at the age in India, which is around 45 to 48, menopause usually happens, and with that the exhaustion of the eggs also is indicated. So exhaustion of eggs is basically evaluated by a test called AMH, which is anti-Mullerian hormone, and this anti-Mullerian hormone will in fact tell us the number of eggs and also the quality of eggs in the lady. So once we see that the AMH is less than 1, that means that the eggs are almost exhausted in the ovaries. We usually prefer to go for a donor oocyte program. Now, in a donor oocyte program, what happens is basically another lady who is a younger lady whose age group is between 21 to 28 years as per the ICMR guidelines is chosen, and that lady has to have given birth to at least one child in her lifetime. So a lady of that age group is selected, and from her the eggs are taken, and in those eggs, if the husband has normal sperm, those are injected by a process called ICSI, that is intracytoplasmic sperm insemination, and those embryos that are formed are later transferred into the uterus of the female. So few misnomers in this. A baby with a donor oocyte program sometimes is assumed by the general public that the baby will be abnormal. Let me tell you friends, it will be an absolutely normal baby, and there is nothing to worry about the condition or the position of the baby. Rather, when the age group of the eggs is less or the age of the egg is less, then the chances of a normal pregnancy is much higher. We all have to consider the fact that if the eggs are on the older side or the age of the egg is more and the age of the uterus is also more, then the chances of normal pregnancy happening is much lesser, and the chances of anomalous baby or genetic abnormalities in this baby is also much higher. So a donor oocyte program is definitely a program which is taken up much shape in India right now, and it's possible in ART, and pregnancy is definitely possible even after menopause. Second thing that I would like to mention in these programs is that when we are selecting an egg, then the egg can, the donor who will be selected will not be someone of your own relative or someone whom you can select and bring, but these donors we will get for you, so it will be not inconvenient for you, and convenience is what we warrant, and we will select the donor who will be tested for all infections like HIV, hepatitis B and hepatitis C, and also ours is the only center where we even test for thalassemia, so that it's a thalassemia negative mother or a thalassemia negative egg that we give, so the baby does not have any chances of having thalassemia. Happy parenting is what I wish to you all, and I again assure you over here that even after menopause, pregnancy is possible, and definitely you can be a happy couple with a baby in future. Thank you so much for watching this video.